Welcome. Gary and I are back to meet with you and convey some information that's piled up lately. I'll start by saying it's Wednesday, January 20th. As I look outside, it's inappropriately warm for January. It's very pleasant. It was 80 degrees yesterday. Boy, a lot is happening in our world right now, particularly on COVID, so we'll try to make these meetings frequent to keep you up to date. I appreciate that as a provider, you might feel sometimes you're the last person to hear things, so we'll try our best. So I'm going to start and go right into some COVID issues that are timely. I'll turn it over to Gary.
So I actually have some good news. We've seen the second wave of the pandemic, and I think the second wave we peaked. I'm going to show you some data. So this is data from the Sutter Bay area. In the Sutter Bay area, I put an arrow to the right-hand side of the slide, and this arrow demonstrates, I think, that we've actually come down from the second peak a little bit. I think we're beyond the worst. And we'll talk about variants in a little bit. Some areas in the Sutter Bay are not experiencing a drop yet in the second wave like Santa Clara. But I think for our system, we're seeing fewer tests being sent out and a lower percentage of people positive. So I also want to show you the second graph. The second graph is a graph of Sonoma County. And I think Sonoma County mirrors what we're seeing in the Bay Area. And again, I put an arrow there to show you that I think Sonoma County is a little bit on the downside of the second wave, and that's very reassuring. I'm hoping, unless things change and we're not careful about social distancing, we're not careful about the economy and businesses, I'm hoping that the second wave doesn't surge again and that we'll see improvement. So that's very good news, I think. I'd like to show you one more slide. There's been a lot of news recently on the variants. And as this RNA virus mutates, which is very natural for it to do, what we're seeing is that some mutants become a predominant strain. That happened back in March when we had the Italian variant come out. And this time, what we've noticed in the United Kingdom, a new variant came up called B.1.1.7. And then that exploded in the UK in December. We've also seen one out of South Africa that's actually more contagious than the UK one. They're studying one in Nigeria. And there's been 2 variants in Ohio and actually one in Santa Clara that's being looked at by laboratories at UCSF. The variants, some of them appear a little bit more contagious. The UK appears maybe 56% more contagious with mathematical modeling, and the South Africa one may be a little bit more contagious than that. But we expect to see the variants, they're not more dangerous. And so the variants don't lead to more severe disease, they just lead to more transmission. And that's why the vaccine campaign is so important right now. We need to vaccinate as many people as possible before the variants become predominant.
Wow, okay. I'm going to switch gears a little bit now and talk about some practical operational issues, particularly with our efforts to vaccinate. As you've probably been told, Sutter has about 100,000 or about patients who have touched us, who have a Sutter record, and that's going to be our goal, to vaccinate those individuals. Where we're at right now, we currently have 2 sites up and running. That's at Stony Circle and at the 3rd floor of the Airway building. And tomorrow we're going to start vaccinations at the Luther Burbank Center. There are plans for a few other primary care sites to do vaccinations. Those have been put on hold. You may have heard about the Moderna lot of vaccines that was sequestered and that applied to us. So we had to scale back a little bit for that. And I just want to make one point. Those vaccination clinics that are operating in clinical care centers, bear in mind that the vaccination operation is really separate from your clinical operations. By that I mean, we do not have the capacity, if you're seeing an 80-year-old and say, oh my goodness, you need a vaccine, one should go across the way and get your vaccine. That's just not going to work. The logistics of administering the vaccine are a lot of paperwork, and people have signed up, and so it's not going to be spontaneous. So unfortunately, people will still have to go through the vaccine route, which I'll explain. In terms of the numbers, currently we're doing about 30 a day at Stony Circle, doing about 150 a day at Airway, and starting tomorrow, Luther Burbank has a schedule that will allow for 630 vaccines. All these are kind of starting slow to work out the kinks. Obviously, in 28 days, when the second Moderna shot is required, all these sites are going to immediately double in their capacity. And we have high hopes for the Luther Burbank site to maybe get up to 1,500, maybe even 2,000 vaccines a day. Again, that's all going to be depending on our availability of vaccine, but right now it's looking fairly optimistic in the near future, but it's going to be week by week. There has been some talk, the labor pool is a big issue. If you can imagine all the shots we're delivering at the Luther Burbank, the plan to peak there would be to have 34 different individuals vaccinating all day long. So it's going to require a big labor pool. Our operational foundation people are working hard in identifying who those people might be, but there will be an opportunity for us, SMGR providers, to get involved as volunteers in this effort. Don't need volunteers right now, probably over the next couple of weeks as our foundation staff are coming back for their second shot, and certainly as we move into the next tiers in our priorities, it will become necessary. The way it's working now for a SMGR provider, we just need you to do the federal mandated education, and that is on the health stream. Likewise, for any IC who wants to be involved, that we're going to be sending them a link to the similar information in a different spot. And we're working out how we could handle to receive volunteers that are retired physicians that have previously had a relationship with us. My assistant, Erica McGuire, has a lot of this information. If you are an IC, you can contact her to get the materials to do the education. We're going to start compiling just a list of names, and as these volunteers are needed, then we'll be called upon. Just kind of remember, this is going to be a marathon. If you do the numbers, we're just going to be in this over 75 crowd for at least a couple of weeks. We have about 15,000 patients over 75. So, when we're really going to be needed as volunteers might be a month or 2 months from now when the staff are really getting tired, because this is a many months long slog. So where are we with vaccination? We're currently finishing Group 1A, which are healthcare workers, and we have started on Group 1B, which are those individuals that are over 75 years old. And like I said, it's going to take several weeks to get through them. The way they're contacted is those individuals over 75 received an email with a link to the Sutter website where they could book an appointment online. There was a phone number they could call. And soon we will be reaching out to those individuals in that category over 75 whom are not on My Health Online, and we'll be calling them. The question is, who's next? So who's coming up next in a couple of weeks? And it's a bit of a fluid question. As you all know, the CDC and Governor Newsom announced that we should start with people over the age of 65. Sutter did not follow that, and I'll tell you the practical reason was Sutter had all their communications ready to roll out on a Thursday morning, and it was the Tuesday evening that the CDC changed their mind, and Governor Newsom just the day before, and it was really not practical or possible for Sutter to change all their communications, and that's why we went with the 75-year-olds. But as providers, I'm sure you're hearing from people over 65 because they are serving that population elsewhere. So it's possible that Sutter will move it down to 65, or it's likely possible that we might go to the next line of essential workers. And here is a slide that you've seen before. It was sent out by myself last Thursday. These are the frontline essential workers on top and other essential workers on the bottom. And again, we are going to, the Epic is unable to pull this information, so we're going to ask you to identify these people. That should not be a separate task, but when you bump into these people, if you could send their names and their chart reference to that pool that I've listed at the bottom of that slide. It's also on the email I sent out to you. So that pool is just going to have a big list of names of essential workers, and when we get close to that tier, we'll be contacting those people. So that's where we're at. Everything is fluid. If you just read the newspapers and watch the news, you know that's the case already, but hang in there. We're about to go on a long ride. So I'm going to turn it back to Gary then for some practical advice about handling the vaccine.
So I know that a lot of physicians, especially primary care, are getting inundated with emails and questions from patients. So I took this compilation. I'll show this slide now. This is an FAQ that patients are asking, questions patients are asking. And I took this from the New England Journal of Medicine. They have a great FAQ site. I also went to the CDC and to the Infectious Disease Society of America, and I looked at all those questions, and I put those together into this compilation. And really, on this FAQ, this pertains to the Moderna and the Pfizer vaccines. Questions come in this nature. The only question that's no is can I get a second dose of this new vaccine if I had an anaphylactic reaction to the first one? That's the only no. So if you had an anaphylactic reaction to the first dose, you can't get a second dose. However, if you've had anaphylaxis in the past to something else like peanuts or shellfish, can you get a COVID vaccine? You can get the Moderna and the Pfizer vaccine. We'll just watch you a little bit longer. And you don't need to take any pre-medication for that. A lot of the other COVID questions are pretty simple, straightforward, and I put them in this slide. Can I get the vaccine if I've had COVID before? Yes, you can, and there's a 10-day window there. Can I get the vaccine if I've ever had Bell's palsy or Guillain-Barré? And the answer to that is yes, you can get it, because these vaccines are not contraindications if you've had Bell's palsy or Guillain-Barré. A little different from the flu vaccine. Can I get the COVID vaccine if I'm pregnant or breastfeeding? And the answer is yes to that. Actually, it's a recommendation by the American College of OBGYN. So I'll send this out to you, everyone, and hopefully this will be a very helpful FAQ for answering for your patient questions.
And I understand, Gary, because there's, I don't know, is it 1 in 100,000 anaphylactic reactions or something very small, but that's the reason why you need a licensed provider on site. So at Stony Circle, there are doctors there, at Airway, there's people. What about Luther Burbank?
Yes, so that's a good question. There will be physicians on site in case there is a rare anaphylactic reaction. And you're right about that. It's about 1 in 100,000, maybe a little bit less than that. And so, for example, on this Thursday, I'll be at Luther Burbank with my laptop, doing meetings, being available should someone have a serious reaction. So it does take a medical provider a step above a nurse.
Okay, thanks. And then I'm going to just share with you some more practical information that was compiled by, I believe, Gary and Sean. I think Anna Pacheco helped out. We get a lot of questions about, hey, do I need to be tested from patients? Do I not need to be tested? When can I go back to work? They have created 5 different charts that will help you answer those questions. And again, this will be coming out to you. I'm going to show you 2 of those right now. The first slide just addresses a SMGR provider. What would happen if you become exposed? And again, you see on the left, it doesn't matter if it's at work or at home. It's really broken down just do you have symptoms or not. If you have symptoms, you go home immediately. Talks about how frequently to test. If you don't have symptoms, then talks about how to test, but you can stay at work. So we're sending this out to you as a resource. Obviously, your contact in there is Dr. Mitnick, the CMO. This is a resource that you can use. And then the next slide talks about returning to work for a healthcare provider. And it breaks it down into whether or not you're asymptomatic or not, when your positive test was. I'll let you read through this, but hopefully this will be useful for you as you field phone calls. The other charts are about non-healthcare workers, so it'll give you advice for your patients. So that's all I have. Gary, do you have anything else to add? Or?
Yeah, we showed you a lot of slides today, and there's a lot of good information here. We're going to be sending this slide deck out to you guys in a PowerPoint fashion. So you'll be able to print this, and whatever slides are useful to you, keep right next to your desk. And we just ask you not to forward this outside this other system.
Right, well, thank you. Thank you, everybody, for your hard work. You're doing a great job. Hang in there. We'll be back.